Okay, welcome everyone. This is today's webinar on engaging employers in respite and caregiving support. I hope you can all hear me okay. If not, please, well, if you can't hear me, you won't be able to type into the chat box. But if you can let me know that, or let me know that you can't hear me. My name is Jill Kagan, and I'm Program Director at ARCH, the National Respite Network and Resource Center, and we're really delighted to have all of you joining us today. We're going to get started, and we will be holding questions until after all of our presenters have had a chance to advance through their slides. But feel free to go ahead and type your comments or questions into the Q&A box that you see in the bottom right-hand corner of your screen. You can do that at any time, and we'll be monitoring those, but not posing the questions to our presenters till they're done presenting. If you want to download a copy of today's PowerPoint slides, you can visit the pod that's marked materials on the right-hand side of your screen. Highlight the document that says Webinar Employment Engagement for Respite, and then click Download File, and you'll be able to download those PowerPoint slides. I do want to let you know that we are recording the webinar, and we'll make the recording link available to you probably early next week. I'm really so grateful to our speakers today for taking time from their busy schedules to share their expertise and their resources with us on working with employers to support caregivers. We're quite familiar with the statistics that 2/3 of family caregivers are in the workforce, and finding ways to share respite information with them can be very challenging. I know some of you who are grantees or state respite coalitions have already been working with employers to make sure that they have information about respite that they can share with their caregiving employees, and that there are many more of you out there who are quite eager to find strategies to begin to engage employers in your state. I thought it was very timely just this week. Voya Financial, which is a large investment firm, released new survey findings about the needs of working caregivers. And none of these findings are surprising to us who work in this field based on what we already know about the pressures that working caregivers face. But the data are compelling because they surveyed a relatively large sample of caregivers and human resources personnel, as well as general employees from all major industries in the U.S. And I wanted to just share a couple of the findings. They found that 81% of caregivers report experiencing added stress or anxiety at work as a result of their caregiving responsibilities, while 90% of employees who are caregivers feel like they lack company support in some areas. And when they surveyed employers, they found that 44% are unaware of the incidence of caregiving among their employees. And this lack of knowledge about the issue among so many employers really caught my eye. And I think it's made this discussion about how to reach and educate them even more timely. And it's also been a while since, as a network, that we focused on this issue. So I'm really very excited to bring all these speakers to you to share their updated information about what they've been doing and some new resources that you'll be able to use in your own work. I will go ahead and introduce our presenters. Very pleased to do that. We have with us Dr. Kristin Litzelman with the University of Wisconsin's Cooperative Extension Division. And she's going to be sharing the tool that they developed to educate and engage employers in supporting caregivers. And very exciting is that she's going to show us how we can actually use that tool in our own work. She's joined by Sharon Johnson, who I'm sure many of you know, with the Nebraska Lifespan Respite Network. Sharon is the program coordinator in Children and Family Services in the Nebraska Department of Health and Human Services. And she's joined by Kim Falk, the Respite Employer Engagement Coordinator at the University of Nebraska Medical Center Monroe-Meyer Institute. And she's going to talk about their own employer survey, the employer engagement activities they've been pursuing for the last few years. So those of you who may be familiar with their work will get an update today, and they're going to talk a little bit about the evaluation they did of those activities. So I am going to turn it right over to Kristin to begin. Take it away,
Yeah,
Kristin.
thank you,
Thank you
Jill.
so much.
I am so happy to be sharing this information with you today and thrilled to hear about the Voya study. I'll have to take that information and add it into my portfolio of information that I rely on to think about these things. So today, as Jill mentioned, I am going to be telling you a little bit about a tool we have called the Employed Caregiver Survey. And of course, I always like to have objectives. So let's start with that. When you get through the rest of my talk today, what I'm hoping you will come away with is an ability to describe the prevalence of caregiving among workers. Some of you may already have a good feel of this, but it's going to be new, I think, for some people. You'll be able to recognize the impacts of caregiving on employees, employers, and you'll be able to discuss the Employed Caregiver Survey as a tool to understand and act on the needs of caregiving employees. And I hope you'll be able to take that and then apply it. And so bring it into your communities and bring it to the employers that you work with, or even to your own organization, to help understand better what the needs of these employed caregivers are. So just to jump right into this basic information, there are approximately 40 million US adults who are caregivers, and of those, approximately 60% are also working a paying job. So that's about 24 million adults. And this is not just working a little bit here and there. On average, these workers are at or near full-time employment. The average is 34.7 hours per week. And if we look at it dividing a little bit differently, 1 in 4 of these caregivers is providing more than part-time, more than half-time of work. And so they are of care, I should say. So they are doing a lot of care, and they are doing a lot of employed work as well. They're essentially working 2 jobs, and that can be very stressful for the caregivers, as we just heard. And what's interesting, something that's not often considered, is that this does span age groups. So often when people think of caregivers, they have sort of a specific persona in mind. They have an image of a person who is a caregiver. But it turns out that caregiving is much more varied than that. And that can make it hard for us to think about the way our employees are impacted by the caregiving role. So approximately 50% of employed caregivers are in an older age group. They're 50 years and older. But we have a large proportion, about 29%, that fall into the 18 to 34 age group, and another 21% that fall into that 35 to 49 age group. And each of these ages comes with different implications. If we're talking about older caregivers, they are often dealing with their own health issues. They are often at the prime of their career, and they're starting to think about retirement. And so they're thinking about the implications of what that might mean. When we look at the younger caregivers, they may be experiencing caregiving very differently because it's off time, it's off cycle for them. They're not the typical person that we think of as a caregiver. And then in that middle age group, we have a sandwich generation some of the time, where the employee may be caring for young children, trying to balance work, and then also doing health caregiving as well on top of that. And so they end up with a lot of pieces coming together for them. And when we think about this in the context of work impacts, what we see is that the majority, the plurality of caregivers who are working make some kind of workplace accommodation. In total, 61% made any kind of accommodation, and you can see that when they're providing more hours of care, they're more likely to have to make some sort of accommodation. Almost 50% used some kind of flex time. About 14% had to pull back in some way, and so that could be reducing work hours, taking a less demanding job. That can be impactful for the employer as well, because their top employees may not be taking promotions, may not be doing travel that they would like them to do because of their caregiving role. And approximately 6% said that they stopped working altogether because of their caregiving role. So this is very impactful. And what's interesting is that just more than half of employed caregivers say that their supervisor is aware of their caregiving responsibilities, which means that the other half, their supervisor has no idea that they have this going on. They may not know why the person is taking flex time. They may not know why the person is turning down promotions or refusing to do overtime work. And so that is something that's important for organizations because if the supervisor, if the organization doesn't know that employees are experiencing this, they aren't able to respond to it in a way that benefits everyone. So failing to support these employed caregivers has really significant consequences for both the employees and for the employers. In the context of work consequences, you see things like increased absenteeism, unplanned absences, employee turnover, decreased employee retention, productivity loss, presenteeism, where employees are there physically but not there mentally. And when we look at this from sort of a broad example, I have an example here from Canada from back in 2012. And of course, the context is a little different, but I think it resonates. In total, because of caregiving in 2012, Canadians had 9.7 million days of absenteeism from work, 256 million fewer hours of paid work, and a loss of over 500,000 employees from the paid labor force because of these caregiving responsibilities. And so that is incredibly impactful for our communities, for our employers, and for the family caregivers themselves. So how do employers respond to this? Well, there are caregiver-friendly workplace policies that can help improve the situation for both the caregivers and the employer. So this often includes things like flexible work arrangements where employees can come in early or leave early or shift their work around in a way that works for them, take an extended lunch, that kind of thing. There are support and referral services that some employers can offer. So this might be things like an employee assistance program where if the caregiver needs to find a new in-home health worker, they can ask someone else to do that. And so they can spend their time vetting a short list of good candidates rather than trying to do all of that work themselves. And so that might be one of those support and referral services. Many employers offer educational opportunities. Sometimes these are lunch and learn opportunities where they have presentations and tell the caregivers and the other employees more about information relevant to their role. And sometimes they even have more extensive supports. It's not unheard of for there to be in-house case management, in-house adult daycare facilities, and of course, not every employer can handle that and make space for that. But there are cases where employers have really done a lot in order to make caregiving as easy as possible for their employees. And this has beneficial outcomes for everybody. It increases employee retention and it decreases turnover. It reduces absenteeism. And for the employee, it decreases stress and role conflict and makes it much easier for them to do their job. And so that brings us to how employers know about this and what they do with it. So the purpose of the Employed Caregiver Survey is to help employers understand what caregiving looks like in their organization. How widespread is it? What are the needs of the employees? What are the consequences at the work level when employees have these caregiver roles? It's really understanding the depth of the role outside of work. And it gives the employers an opportunity to enhance or better disseminate caregiving-friendly policies and supports. And so that was why we created this tool. It was actually created by my predecessor here at the University of Wisconsin in order to serve this need that we were seeing in communities to increase employer understanding of the caregiver responsibilities and find ways to match up those needs with supports and resources. So the way that this works, if an organization was going to use the Employed Caregiver Survey, it's administered to the employees through us here at UW-Madison. So ideally, we have an organization working with some sort of central person in the community. It's often an extension educator or agent here at UW here in Wisconsin, but it could be an ADRC or an agency on aging, but someone centralized to help guide the organization through this process and help them think through the next steps, someone to facilitate the process for them. But we do also serve organizations directly. And what happens is the organization or the external champion fills out a survey request form, gives us some information and requests that we do a survey with them. The employer then receives an anonymous survey link, which they distribute to their employees. The survey is open for usually about 6 weeks. It only has 20 items. It's really quick, about 10 minutes. And we encourage the employers to give their employees time and space within the workday to do this because it's really going to increase the amount of response that they get and increase how much information they're getting about the employees they have that are caregivers. And then the employer receives an aggregate report. So they don't see any of the raw data, but what they do see is the information all summed together about what is happening within their organization for employed caregivers. So let me tell you a little bit more about what that looks like. Employers get information about a number of things. They get information about the proportion of respondents who have caregiving responsibilities, the distribution of the types and intensity of caregiving. So what's the depth of that caregiving and the distribution of that caregiving for their employees, the impacts on work, and then also the topics about which caregivers would like more information so that they know how to respond to this. And so let me give you just a real specific example here. So this is an example based on real data for a company that we will call the Acme Widget Corporation. And when they did their survey of their employees, what they found was that a full 65% of respondents were caregivers, almost 2/3. And among the most common activities, there were some basic things like driving a care recipient to appointments or doing home maintenance or yard work for someone. But then there was also a significant subset that were engaging in really intensive care tasks. Personal care, like bathing and feeding, was about 23% of the respondents, and assisting with medications was almost 20%. And so that's significant because those are the kind of things that create some potential burden and potential stress for caregivers and really create some of that role strain where individuals are trying to balance the caregiving that they're doing and the work that they're doing and have the risk of absenteeism and presenteeism. Among the respondents, a full 44% of caregivers were a primary caregiver. So they were the one doing most of the care. And when we look at the work impacts, we saw that 2/3 of these caregivers left work early to provide care. More than half missed days of work specifically to provide care. More than approximately half said they were unable to focus. And a significant group, 13%, turned down work-related travel and considered changing employers because of the caregiving that they were doing. And a full 16% considered leaving work entirely. So this shows that it has tangible impacts on the employer themselves in terms of employee retention, in terms of productivity, employees' ability to focus. And when caregivers were asked about which topics they'd like to learn more about, a full 50% said they wanted to learn more about the caregiving benefits and services offered through the employer. So that just gives you a taste of what this looks like when the employers get a report, what kind of information they're getting. So the next step then is really key, and that's the process of helping the employers reflect on the responses and understand what they're learning. So the first step is, what was their response to the report? Was this what they expected, or was there a surprise in here? Did it increase the employer's awareness of the issues faced by their caregiving employees? Did they understand better what the scope of caregiving was and what the impact on the caregiver themselves and on employment was? And did it change any of their awareness of the work-related impacts of caregiving? And then there's the question of what the caregivers have needs for and whether or not that aligns with what is currently available in the workplace. So for example, caregivers may not know about FMLA and they may not think that they can take time off. And so informing caregivers about that can be helpful, but unless the employer is assessing this, they might not know that there's a disconnect there. Flex time might be available, but employees aren't using it. And that could be indicative of them not knowing that they can ask, them not thinking that they should ask, or it could be that there's a culture where flex time is frowned upon. And so there may be some deeper work of thinking about that culture and the way that flex time is approached from a management level and the way that employees are rewarded and evaluated that may help shift the balance here. And so we also provide a checklist of workplace supports to help the employers think about, do they already offer these things? How often are they used? And how to connect that through to where there are places where additional supports could be put in place and where there are places that existing supports can either be disseminated better or can be encouraged more, or where there are changes that need to be made in order to get those services and supports used in a way that increases productivity and benefits both the employer and the employee. And so then we end with intentions. What are they going to do? Are they going to offer additional workplace supports? Are they going to provide additional caregiving information? Are they going to have those lunch and learns? What's their plan, and how are they going to do that? What are the goals? And so this is available right now to everyone. One of the things that we do is then connect the employers and the caregivers with resources. And so what you're seeing on the screen here is the web address of the website where some of this information can be obtained. There are videos that talk about caregiving in general, as well as what employed caregiving looks like, both the caregivers' experiences and why employers should worry about that. There's information about best practices that we've seen in other organizations and success stories, and also additional resources that employers can connect with and caregivers can connect with to learn more about how to deal with that tricky balance and those tricky role interactions with being an employee and being a caregiver simultaneously. And so this is a resource that we continue to work on. As I mentioned, it originated with my predecessor and has not been updated in several years. And so that's part of what we are doing. We are starting to look through those resources and update and connect in additional information. The Savoya study we will probably pull in, and there's another several sets of resources that I would like to get onto that website so that they're available in updated form for people who want to use those. We also are interested in connecting with other initiatives. So here in Wisconsin, there is a coalition that is working on working with employers to help them understand what's going on. There's the work that you all are doing here. So making those connections and sharing best practices and amplifying our impact without duplicating the efforts that we're making is really important to us. And then continuing to connect the dots for both employers and employed caregivers. And by that, I mean helping employed caregivers understand what benefits and resources are available for them and what the impacts of caregiving can be on their job and themselves personally, and also helping employers understand why this is important and what they can do about it, what those best practices are, what the impacts are, and really what they can do within their own organization in a very concrete way to make changes for their employees who are caregivers. So I have questions up here, but I think we're waiting till the very end for questions. If anything comes up, please put it in the chat box. And if you do want to learn more, there is a web address here to an e-extension web page where it talks about how organizations can connect with the Employed Caregiver Survey so that they can figure out what's going on within their own organization. And you're also welcome to email me. I would love to hear from you. And with that, I'm going to hand it back off to Jill. Thank you.
Thank you so much, Kristin. I think it's so exciting and generous of them to be willing to share that survey tool with all of you, because it's a great entree into connecting with employers that you're thinking about working with. But I'm now going to turn it over to our Nebraska Lifespan Respite folks. Sharon, please go ahead. Sharon and Kim.
Okay, thank you. I appreciate that. Kristin, such exciting news that you were sharing, and it is such a perfect lead-in that in Nebraska we're able to provide those participating today an example of how we started and how we can blend in the work of the very specific evaluation tool into the larger infrastructure that we have put into place that started with our pilot. And we'll talk about that in more detail. We started that really before the grant was awarded in 2015, probably back in 2013, 2014. Arch had provided more than one webinar on employer outreach, and it got me thinking and working with our Nebraska partners, one of whom is the Nebraska chapter of AARP, who we all know to be strong advocates of older workers. And with that, it more than raised questions, and as I did research of available resources and running the various programs and understanding the needs of the family caregivers in our states across the different funding sources, clearly we had many family caregivers who were employed. And so the question naturally was, what are we doing to help inform the employers of the needs of those family caregivers? And with the grant pilot project, we did begin formally in the year 2015. We started as a result of ARCH having a webinar, and I want to say there might have even been a couple of different webinars, which really generated a great deal of interest. And with that, started looking at a variety of the national resources and the organizations who were providing employer engagement activities across the country. One of Nebraska's key partners has been very actively involved in older American employment, which is the AARP Association. And so together within our Nebraska Caregiver Coalition, there was real interest in seeing what we could do to partner and explore employer engagement activities. And the more we looked at materials that were available, there really, as with most pilot projects, there were more questions that needed to be answered and even issues that needed to be defined, which is why we do pilot projects. So we did then go to the University of Nebraska Med Center and Nebraska-Madison, which is, as you know, Kim is affiliated with. And for multiple reasons, not short of the fact that the University of Nebraska Med Center, Monroe-Meyer Institute in particular, has keen resources available for evaluation. Before starting any pilot project, it's important to know what we're wanting to evaluate and begin looking at what those questions are. What is it we want to know? And so with having not only the numbers and a range of types of resources within the Med Center and Monroe-Meyer Institute, as well as this very large two different medical facilities as an example for an employer engagement opportunity, we decided to partner with them in an official capacity, and it's been a very positive experience to have done that. So we looked at what our definition of employer was to be, and clearly employer can mean a lot of different things. But specifically, we knew that the goals themselves for this particular project was that we needed to be able to prepare the employers in general. However, we further defined down the term employer. But we know, for one, that the number of individuals either who have already reached the age of 65 or even over the age of 55 who were moving rapidly toward retirement age and leaving the paid workforce was growing. And with that, the need for caregiver support, as well as the fact that in order to accommodate that, employers needed to be able to understand, as what Kristin has visited with us about through the survey, and what those next steps, once we find the information, and then what. So part of our project goal was to be able to offer to employers what Nebraska resources that have already been put into place, but targeting this new population of audience as to who needs information about family caregiver resources, and then helping them to get the information to the employee caregiver. And then equally so, whenever we start a pilot project, we have the expectation that we're going to be able to continue it beyond existing funding and have it as a sustainable activity. And so another goal was to certainly have it as a replicable model for employers that we could use across the state and the nation. So although the pilot initially with all the different activities that Kim will go into further detail, what we tested out, some with considerable success, others less so, that did not make it necessarily into the statewide model that we have in place today. But we needed time to determine what our forms are, what our strategies are, who our targeted employers might be. And so Kim is going to share with us what that process looked like, what we have in place today, and then I will wrap up with some additional comments regarding what we're doing with our sustainability and what some of the key lessons that we have learned as a result of the pilot. So Kim, if you would move forward.
Yes, definitely. Thank you, Sharon, and thank you, Jill, for inviting us to be here today. So Sharon mentioned, I'm just going to go ahead and start with first our pilot project that was a 3-year program. And what we were looking at that time was the respite evaluation for the state of Nebraska, creating the respite employer engagement, as well as Ecology curriculum, which we will save for another day, but that was just part of our project at the time. We first needed to make employers aware of why we wanted to let them know this information. And here's some statistics, and many of you are familiar with this type of thing, but we know that for individuals who don't have much, individuals who don't have much knowledge about disability or chronic health care conditions, they might not realize the statistics we are showing, that 43 million adults in the U.S. are family caregivers of an adult or a child with a chronic condition or disability, and 80% of those are needing long-term services and supports, and they are living at home. So that is over 34 million people that are caregivers and could need a break from time to time. So we just put a couple of slides together showing some of this information, including then this slide from courtesy of NAJUED from 2016, that actually uncompensated families and friends provide $47 billion worth of caregiving compared to Medicaid spending, which totals $449 billion. So we're actually, unpaid caregivers are actually spending more in comparison to Medicaid. So these were just ways that we started to come up with ideas of catching the eye of employers of why it was important for them to know this information. Now, these next few slides start with, as I mentioned, the respite evaluation across the state. And these next few slides are direct findings that were produced by our program evaluator, Dr. Jolene Johnson, here at Monroe-Meyer Institute. Jolene has a lot of experience. She has been a program evaluator here at Monroe-Meyer Institute for over 20 years. But this is just one particular choice, or one particular data selection that it shows the levels of stresses for the care recipient and the care provider before respite, after receiving respite, and then also, if you notice, when the idea of taking the respite away happens, which is the green color, stress levels went up for everyone. So this was just one piece of information that Dr. Jolene Johnson found. And please feel free, I know that may not pertain to all of you since it's specifically for the state of Nebraska, but we can share more resources with you about the evaluation if you would like them. Our next slide shows how respite improves caregiver health. And I won't read all of these word for word, but we have before they received respite in red, and after respite in purple. And you'll see how things decreased as far as headache, chest pain, fatigue, anxiety. All of those things obviously went down when a caregiver was given a break, when respite was provided to them. And then also in our, just over a 1-year period of time during the evaluation, we saw how the number of caregivers was increasing month by month, yet the number of care providers available in our state decreased. So, and that is something we wanted, this is the reason that we are trying to share the employer engagement information. We know this is going to happen with the aging of the baby boomer population. We are going to need to find more caregivers or more care providers, and we want to make employers aware of that. But this data just from 1 year in Nebraska shows that as well. And this caregiver support ratio, which is supplied by AARP, as Sharon mentioned, has been a partner with us. This just gives a very clear view of how the number of caregivers available is going to decrease over the next 30 years and even over 40 years in this particular module. But in 2010, there were 7 caregivers available. In 2030, there will be 5, and by 2050, there will only be 3. So just making something as obvious as this image has been very helpful. It just is a very cut and dried example for people. And now, why do employers need to be involved in all of this? We may see that particular message, but employers, okay, so there's caregivers out there and they need a break, but do they know that 6 out of 10 family caregivers reported having to drop out of the workforce or reduce their work hours or have received bad evaluations to their caregiving responsibilities? And some of that ties into what Kristin had to say at the beginning. It does have an impact on their job. And so it's up to employers to provide them information about respite. And we hope this helps a little bit with their personal and professional balance in life. Now then, we got this information together, and we started to place pieces together of our pilot project, which is the next few slides that I'm going into. Our objective was to evaluate the impact of employers offering and promoting respite to their employees. Over this was a 3-year project, and during that time, we wanted to develop relationships and partnerships with anyone on our campus at UNMC and Nebraska-Madison who we thought would be good resources for us to reach employees. We started with human resources, employee relations departments, employee assistance and wellness programs, and public relations for getting the word out there. We were just trying to figure out the best model that we could create and then pass on to members of our Nebraska Lifespan Respite Network, our local regions, so they could then replicate that to employers across the state. We started here at UNMC. We did want to just figure out what our baseline perspective was for the understanding of caregiving and respite care. And you would think that on a medical campus that people would really be aware. It was interesting to find out that not all people were, or they may have had a general understanding, but it really hadn't been something that had made an impact on their life, or they didn't have to follow up on that a great deal. So we asked 3 baseline questions. And what was your current understanding of respite care? And 7 out of 8 people had a general understanding. And this was, I should mention, this was one human resource department, but we did evaluate other people as well. The second question was the respite respite information are you currently providing to UNMC and Nebraska-Madison employees? And 4 had knowledge of the employee assistance program's dissemination of respite, and 4 had no knowledge of any respite resources that were available to employees. And then approximately how many respite referrals have you made in the past year, and to what organizations did you send the referrals? And nobody on campus knew of actually any referrals. And our employee engagement program, although they had respite resources, they did not track any of that information to find out if they had actually referred anyone to obtain respite. So that was interesting findings right there. But that gave us baselines to go on for what information people needed to know. And then from there, we developed the steps that we proceeded with for the remainder of the 3 years. We attended all new hire orientations, deliver brochures, applications, explain what respite is, and we collected contact information for further follow-up and data collection, and make sure people were getting directed to respite resources if they needed them. We wanted to create a respite resources website or link on our campus website that included links from Department of Health and Human Services, our Nebraska resource and referral system, as well as other resources, prime respite resources that people may need. We wanted to attend lunch and learn opportunities and to attend all wellness events and health fairs on campus. We presented to managers, department heads, and supervisors here on campus. We found that in larger organizations, it was good to get messages to different levels of management or department heads that actually could, that were more in touch with employees on a regular basis, like head of HR on our campus, because it is so large, is not directly in touch with people. So we did find reaching out to other management levels was helpful. And then we made sure that everybody was informed about our partnership with the Nebraska, oh, I'm missing Lifespan right there, Sharon. I'll get that fixed, but the Nebraska Lifespan Respite Network, because the Nebraska Lifespan Respite Network is the referral source for our employees, for anybody who needs respite for all caregivers around. So we wanted to make sure everyone knew that our partnership, about our partnership with them. So a few steps of, I'm just going to show a few slides of some of those things that I mentioned, just ways that we were reaching out. And the first slide here is the impact of attendance at UNMC and Nebraska-Madison new hire orientations. And this, I did actually update this. Over the last 4 years, I have attended 140 orientations on our campus. And this was just a great program as far as really developing relationships with our human resource department, with employee assistance programs, with public or employee relations, public relations, marketing and wellness programs, because they all attend orientations as well. And you can see in our data on the side as far as the number of brochures that we distributed, the number of employees we reached, and the number of follow-up contacts, it was successful. I will mention with this, though, it is effective for me being here on campus, but when we start looking for coordinators across the state and the size of our state and the size of their regions, there are especially the more rural parts of our state, this is a challenging program to sustain for all employees or employers and respite coordinators, because one respite coordinator can't be at all employees' new hire orientations. However, if you are able to at least give information that can be distributed at new hire orientations, we have found that to be effective as well. It just gives employees an introduction, and you can be sure that when employees are new, they're eager to learn and want to learn more, and this may just be a bit of information they weren't familiar with before. The next key piece that I wanted to talk about was creating a website. We did feel like it was very essential to have a website available on our campus website, both at Nebraska-Madison and UNMC, just so employees could have access to it when it was comfortable for them to find it. This was a confidential way for them to look up information, to find out resources, but it was also just made available that if anybody types in respite on our UNMC or Nebraska-Madison website, they're going to be able to get directly to this. And we are now encouraging, which I'll show you in a few minutes, we are directing more people directly to the Nebraska Resource and Referral System. I am going to go ahead and open up our page, though, our UNMC Respite Care Resources, that we still have active. And it does just show, well, first it confirms. We always want to confirm that people know who a caregiver is and what respite is. So we do define that at the paragraph right at the beginning. And then we explain things about the Nebraska Lifespan Respite Network, the Nebraska Resource and Referral System, as well as a link directly to our Department of Health and Human Services. So people have access to go to a variety of different places, whatever they may need. And then when you get down towards the bottom, there's the applications available, and also contacting your the respite coordinators in your area. So we wanted to make that easy for all resources to be there. And I will mention right now, we still have this active, and we actively get over 200 hits. Actually, this last year it was over 300 hits for people looking up respite resources just right here on campus. So that is a key way of reaching employees. If the employer is big enough to have a website, this is a key piece. And also just, we wanted to mention, I mentioned this previously, that we really needed to make sure employers knew that they didn't have to do a lot of work as far as setting this up. That the Nebraska Lifespan Respite Network, we are your partners. We are the ones that can help you. We have the resources. We can help your employees. You just need to let your employees know about these resources so they can obtain the information if they need it. So we wanted to make sure employers knew that they weren't going to have to reinvent the wheel. They weren't going to have to hire extra staff. They just needed to make this information available to their employees. So this is just a bit about just our pilot project. Those were steps that we carried out for 3 years, and then we gathered information. We surveyed employees on campus. We didn't get as great of a response, but just as far as to find out if it was beneficial to have these resources. And definitely 93% of the people surveyed said that it was very helpful to have information available. We unfortunately didn't get as much response as we would hoped. But from all the tools that we had used and what we found successful from our pilot, we then created a statewide respite employer engagement initiative employer presentation. And this presentation, I then trained all the respite coordinators. We have 6 respite coordinators. Well, we have 6 respite regions across our state. And we shared this information with all of those coordinators so then they could reach the employers in their region. This makes our program cost effective, so I don't have to travel all over the state. Certainly we can do a lot of things with webinars and teleconferencing and things like that now, but we wanted to make this easy, that this is things that could be replicable, like Sharon had mentioned, that other people can do this. So this is our most current presentation that we have available. We've updated as we see fit, but, and this is also branded now. The other PowerPoint that I presented was our UNMC branding, because we have used that at AUCD presentations, ARCH presentations, U.S. Department of Agriculture. But when sharing this information, employers, we want them to know it's through Nebraska Lifespan Respite, through the Department of Health and Human Services. So this is now all branded in that way, and this is the tool that our coordinators are using. Once again, we just show our pictures just as presenters, and we've encouraged all of our coordinators, if they are the presenters, then they add their photos and titles to the employers they're presenting to. Sometimes they're presenting in person, and we do have a flip chart of this available as well, but the PowerPoint has been our main tool. And so for employers, we defined respite. And once again, we don't, most people don't know what respite is. So we try to let them know about the definition of respite, and then make them aware that there are over 200,000 caregivers right here in the state of Nebraska. Have they thought about how many of their employees are caregivers, and how could they support their working caregivers? So that's usually eye-catching. Some of the data that we've used from Dr. Johnson, we do have just the health symptoms reported by family caregivers, and then seeing once again how they improve with the use of respite. And then we offer specific data about Nebraska. We talked already about what goes on in the United States, but in Nebraska, they want to know there are nearly 200,000 family caregivers in Nebraska that provide 182 million hours of care, and the value of their caregiving is estimated at $2.5 billion. And this was in 2013. We know we will get an update from AARP. Actually, this year in 2019, they update this information every 4 years. So we will have updated information to share. But this is just one of those things, hopefully just something just to catch their eye, to get employers thinking about the fact in Nebraska, this is what's happening. And then we do, once again, mention things nationally as well, which this is the same slide as we had on our pilot project presentation. And then again, showing them the caregiver support ratio. and just how the number of care providers are going to be declining over the next 30 to 40 years. And then as I had mentioned before, it is essential for employers to know that they can be supporting their working caregivers with the quote we already read. But it's becoming harder and harder, at least in Nebraska. We know our unemployment rate has dropped greatly. So it's harder for employers to find good employees. And if they have good employees who are working caregivers, they want to hold on to them. So these are the reasons why they should become informed about respite. We do mention just our our pilot project at UNMC and Nebraska-Madison, and we don't go into a great deal of detail about this, but we do feel like it's a selling point because UNMC and Nebraska-Madison, are obviously supporting this respite program, as well as we are one of the largest employers in Nebraska. So we just hope that sometimes, employers may be interested in doing things when they know other key players are participating as well. We are mainly promoting getting websites or having websites available on employers' websites, referring people to respite, and then we have the link to the Nebraska Resource and Referral System that can get people who are looking for respite directly. I will go ahead and click on that link. But you can right here, there's information for employers, there's information where people can fill out applications, where they can find providers. We want to get caregivers directly to this resource. So that's really the main link that we have just been asking employers to share. It doesn't have to get as complicated and detailed as our UNMC page has been, but because that page has been successful, we've kept it the same. But we want to keep it simple. Employees don't, as I mentioned, they don't need to recreate the wheel. If they can just put this section, this page, basically, this PowerPoint slide on their website in some capacity, it is very helpful for their working caregivers. We do just share these next few slides are other ways if some of our different employers are different sizes, they don't have as big of websites. Sharon had mentioned, defining employers in different ways. So we do still give them other opportunities. If they say, no, a website is not really going to work for us, we can mention how we have reached working caregivers at new hire orientations with the same information I mentioned before. As well as we got into more details. I mentioned previously how we had meetings with department heads, managers, supervisors, that we just can get the information to the right level of management who actually reach the employees in need of respite or the caregivers. So we find out what is the best tool. This is just another way that we can suggest to employers that we can make presentations for their staff. And we did start with this program wanting to really reach wellness programs and hoping that that wellness programs would kind of be our way in the door with a lot of employers. I do tie this together because I have told Sharon that I have found just as much, if not more, assistance or partnerships with employee assistance programs or EAPs. If employers are big enough to have an employee assistance program, that has really been a great tool to use because they're reaching employees in a confidential manner, in a way where employees feel like they can open up a little bit more. If they have not felt like they wanted to let their employer know they are a caregiver, employee assistance programs seem to be a way in for them. Employee assistance programs, they know what employees need. They know caregivers need a break. Employees want to come to them when they're wanting to stay focused on work. So employee assistance programs have been very successful for us, consistently wanting additional tools, more applications, more brochures. And as well as I'll mention with employee assistance programs, just because Arbor Counseling is UNMC's employee assistance program, it doesn't mean we're their only one. They also, are doing employee assistance with other employers. So they in turn are then sharing respite information with others. Even we started, I'll get into this a little bit more, but we also have respite information at University of Nebraska at Omaha, and they have a different EAP program And that, in turn, they are sharing information. They have asked us to present at other employers around the city. So that is a very good, that was just an easy reach for us, but then it was very beneficial because we're reaching other employers with really, without even trying. And then I mentioned the wellness programs. And where we haven't seen as much success, I will say the more and more wellness programs start focusing on mental wellness and relieving stress, then caregiving and respite has tied in a little bit more. A lot of wellness programs still seem to focus, and I'm not saying anything bad about wellness programs, but a lot of them still are focusing, on a proper diet and exercise. But the more and more we see them focus on the mental well-being side of things, respite is becoming more of a tool for them. So those are the main, we kind of offer all of those different options briefly to employers to figure out which will be the best for them. We remind them again that the Nebraska Lifespan Respite Network is going to take care of your employees. If you just offer this information, refer them to us, then we are the ones that will take it from there and help their employees and hopefully keep them employed, keep them working, help their work-life balance, give them a break from caregiving, and have them remain well-balanced employees. We also do share in this program, in this PowerPoint, the different respite programs that are available in the state of Nebraska. I won't go into a great deal of detail on this on these particular slides, but we do just want to find the most valuable program for each caregiver. And there are a variety of different programs. I believe we have 12 different programs here in Nebraska now, besides our Nebraska Lifespan Respite Network, which of course we try to refer everybody to. We know other people may be getting the Supplemental Security Income or Disabled Children's Program. We have an adoption program. We have the Developmental Disabilities Waiver, the Age and Disabled Waiver, Title III for older Americans. We have the Foster Care Program, Medicaid through Personal Assistance Services and Skilled Nursing Care Services, Adult Protective Services, Alternative Response, Nebraska and Western Iowa Veterans Administration Program, and the U.S. Air Force Exceptional Family Member Program. So with all of that, we really are trying to find the best resource for each individual. There might be different reasons that they're getting respite, and we really want each family to get the best bang for their buck, so to speak. So we want to get them the best resource. And it may be different in other states, but in Nebraska, you're just eligible for one respite funding program. So this is why we want to make sure that we have the best option available for each particular individual and family. But we make this available to the employers just to let them know there's other resources, as well as making sure all respite coordinators are asking individuals questions, asking families questions about if they may qualify for something else that is a better fit for them. So that kind of summarizes so far that tool that we are using. And I'm going to go ahead and turn it back over to Sharon to then discuss what our plans are for our next 2020 fiscal year.
Thank you, Kim.
About our sustainability.
And keeping in mind our time where we want to be able to provide sufficient time for everyone to ask questions of Kristin as well as Kim or myself. But to wrap it up, we are now in Nebraska using state dollars to demonstrate the sustainability and the value of the employer engagement. And some of the activities beyond what Kim has mentioned, we have incorporated employment questions on our exceptional needs application so that although we're not currently in a formal evaluation period, when that time comes, we have all this data that we have been collecting, and we have reporting documents that is capturing employment information on employee caregivers and just in general for at least one program to have a better understanding of which family caregivers are employed and how they are impacted. And I'm excited about the resource that Kristin has shared with us today because clearly there are some additional questions that I want to be able to incorporate into the evaluation questions that we've been having in place through the Lifespan Respite Subsidy. And then there have been the need for the technical assistance and having the consistency with Kim as the lead respite coordinator focusing on employer engagement has been helpful because, whoops, excuse me, I don't mean to keep going back, has been helpful. It has taught us that when we started, the respite coordinators were given permission, encouraged to develop their own strategies on how to engage the employers. And there was just a range of outcomes that provided for us. But we had learned that with the technical assistance, that it was improved outcomes to really focus on, as Kim had mentioned, the workplace wellness, employee assistance, and the human resource support. And depending on the type of employer as well as the size of the organization, because we have engaged healthcare organizations, we have retail organizations, social service agencies, educational programs, etc. So for this upcoming fiscal year, and in the state of Nebraska, this year involves July 1st through June 20th of 2020. We are increasing the number of employers that is expected to be in relationship with understanding respite resources, because for some areas we just did not get the outcomes that we were expecting, and there are reasons for that. We've had change in personnel, we've had some funding challenges, some things of that nature, but most importantly, strategic planning is essential, and recognizing job centers are first and foremost responsible for employment. And so in this year, we're having a stronger expectation of relationship with the local job centers or employment agencies, whatever they're called around the country. But they are individuals who have daily relationships with the business community. And so our respite coordinators with Kim's leadership will have conversations as to how we can most appropriately and effectively reach employers of the various sizes and types to be able to provide information to them. What is an effective strategy to get our foot in the door, whether it is through their workplace wellness representative, or if it's a small organization through their human resource staff member or what have you. So what we have learned certainly is quite extensive. Consistency is important. Recognizing that sustainability is a priority within our state, and that we expect that the employer engagement, although it has not always been a fond initiative for some, it has always been a priority from the Department of Health and Human Services, that it is an expectation. It has been a requirement that we have one, if not two, representatives from the business community on each of the local advisory committees, so that they can lend support and guidance on outreach initiatives and reviewing materials, etc. Incorporating employer engagement strategies within our work plans each year, as well as incorporating employer engagement strategies within our sustainability plans and our logic models. Clearly, having Kim's technical assistance has made all the difference in the world, so that as the program coordinator, I am able to work more closely with Kim, who then in turn the respite coordinators have time both on a formal and informal basis to seek guidance and be provided more individual experience from her on ways to be more successful in the outreach with the various employers in their communities. And so what we have learned and we're putting into place this upcoming year, and this came about with the assistance and some of the planning we were doing with the Nebraska Caregiver Coalition in some of the trainings that we are working on. And the discussion a few months ago was on the burnout that we were seeing, and as well as the retirement of so many of our advocates and what we'll term the professional caregiver, which means those of us who are in the business of providing care, whether as a professional social worker, whether as an administrator of a program, but somehow we are in the business of providing care, but in the same time, and many of us on this call can relate to this, we're also family caregivers of loved ones in our own personal lives. And so it almost had light bulbs going off, and I started some sidebar conversations, which then led to conversations around the table with the coalition, which again moved into discussions with our focus and some of the strategic planning for the network, that to help our local networks with the employer outreach for this next year, not only to increase the number of employers that we touch, but to look at our partnership environment. Who is it that sits currently on our advisory committees? Who are we already in partnership with on the various activities of the network? And who do we know are family caregivers as well as working in jobs? So who are they employed by? And so to work with them and their employers on making sure that their organizations understand the respite resources. Sure, that individual may be familiar with respite, but how about the organization in the larger capacity? And I do know that one of our respite coordinators has been very successful in that way, and she had taken the initiative a couple of years ago, and her partnership has had a very successful set of examples of training their organization on respite and have integrated many of Kim's examples that she provided this morning, both through their website and we've provided webinars to their employees across their system. So those certainly are examples of Nebraska's lessons. So with that, I will close our formal comments and return to Jill to facilitate any questions that folks might have for us.
Thank you so much, Sharon, and thank you, Kristin and Kim. You've provided some really wonderful resources for our participants and lots of food for thought. We do have a few questions that came in. The first one, and I'm not sure who it's directed to. I guess all three of you could respond if you have something to say. And the question is, what is the take-up rate among employers? What percentage of workers in your state have been covered? I guess he's referring to Nebraska.
I would say that the take-up rate, we currently have, let's see, we have around, I'm just going to ballpark, around 25 active employers represented, many of whom have multiple sites that represent businesses in multiple locations. As far as the percentage of employees that might represent, I'm not able to give that that number. I don't know if Kim, if you would be able to respond to that. I'm not able to.
Yes, I'm not able for the percentage, but I will just give an update, Sharon, with both. And keep in mind, just to answer the question, we have just been actively doing this for the last 2 years as far as having our respite coordinators touch base with employers, although our pilot started before that. And then requirements for the coordinators was that they contacted 2 employers to provide respite resources to their employees. So we were kind of starting slow. Respite coordinators have many other responsibilities, most importantly being sure that family caregivers have respite. But with that, we now have 51 employers across the state that are actively providing respite. So, but yes, as far as percentage of workers, yes, I am not positive about that as well. That's information that we are working on, though. We have a database that we are trying to be more active about getting that data so we can share that with other employers and other organizations as well. I hope that answers your question, Mark.
Just to clarify, Kim, you just said 51 employers were providing respite. You don't mean they're
Oh,
all
I'm sorry,
respite?
providing respite resources. Excuse me. I'm sorry. Thank you.
That would be a wonderful happening. Then we hope someday that will happen.
Yes, no, I apologize. Talking too fast here.
I just wanted to clarify.
Yes, yes.
Kristin, did you have any response to that question? Maybe a sense of how many employers you've been working with in Wisconsin?
So most of the employers who use this in Wisconsin, it was used before I joined the university, so I don't have a number off the top of my head. It was used a lot several years ago, I would say like around the 2014, 2015 era, which was right before I joined. And then it sort of fell off the map of a lot of our employers. And now we're seeing a rebound where we have communities across the state who are wanting to use this. Both within individual pieces of individual communities, but also in one case, a whole county that is trying to deliver the survey to as many employers as they can, coalitions and health-focused work groups who are working with employers to issue this. And so we're seeing a big uptick. So I don't know, I don't have a proportion for you. I know that it does ebb and flow, and all of a sudden we're in a point of ebb where everyone's really excited about this resource, and therefore I am really excited about helping people to use it.
Thank you. Another good question here. How would you suggest getting the word out to employers across the state?
Well, we are using our respite coordinators to do that. And Sharon had mentioned we asked them to use connections that they know, whether it's the organization they work at, whether it's members of their advisory committee, that type of thing. But you'll be surprised. I mean, as far as I mentioned, you know, talking to one employee assistance program leads us to other employers. And I also would suggest one success, a great success we have had is we were contacting Department of Health and Human Services in Nebraska. And of course, respite is available on their website, respite resources. But for them to use that component internally for their employees as well, because DHHS is also a very large employer, and not everybody is working for respite. So, but when I visited with them, they in turn wanted us to share the information, or they think it's important for all state organizations, state companies to offer respite resource information. So it's not fully in place yet, but we are going to be meeting in about 3 weeks to share that information. But that's just a great information to get information out to a lot of employers all at once. And you'll find when, I mean, just as we have found with people finding out UNMC is sharing respite resources, and we have been a part of this program, other people are wanting to do it. So finding your key players is very helpful, but also just places you have contacts that makes it easier to start.
And I would also encourage you to ask family caregivers themselves who are employed if they have a manager who they feel would be open to hearing this information, if they know an HR representative, if you have an organization, a chamber of commerce. I mean, using those types of resources, but just a simple, if you have a Kiwanis organization, these types of local advocacy groups that are always looking for speakers that support employer groups or just family needs, people who are employed. It's just getting a starting point, and sometimes it's as straightforward as getting a name and contact information and explaining the reason why this is important. In terms of the lessons learned, I've intentionally kept my comments very brief, one, because we lost several minutes, but in terms of the outreach, I think one of the lessons, we have attempted to make it way too difficult. And it doesn't have to be. It's just a matter of having conversations and seeing where they go, and certainly tracking this. And that's what we're doing in this upcoming year is being much more structured with the data and being able to capture the number of employees impacted. And again, it's time, and it's a very few number of us, and the requirements of the contracts that the department has in place are extensive for the funds that are available. So we're getting what we can, but it's something. But it doesn't have to be a difficult process to be able to help at least some employers understand the need for employee caregiver support.
And I'll just add to that. I think a lot of the time you have to say things 15 times and in 10 different ways before they really sink in. And so if there are employers who are hearing about this through the Kiwanis Club and through the HR organization and through their employees one by one, eventually it will click that this is important information, and they will go, oh, I've been hearing about this a lot. I should follow up on this. And so sometimes it just takes a little while where they hear it and it doesn't resonate. They hear it and it doesn't resonate. And then all of a sudden they're ready to address this issue and they're ready to hear more about it. So bringing it to the table from a lot of different places through community coalitions, whatever it happens to be, community development organizations, all of that is going to be useful. And the more you can say it, even if it feels like you're repeating yourself, the better it's going to sink in for the people who will be using this information.
Good point, Kristin.
Great. Yeah, thank you. I think we're getting really close to 4:30. Time for one more question. And that is, are there cultural differences among employed caregivers?
I'll respond to that by all means. One of our respite coordinators had experience with this. Nebraska has multiple meat packing plants with large volumes of refugee and Hispanic, Somalian, a variety of individuals that may have limited English speaking skills, as well as new Americans and such. And what she was able to successfully do was get permission from management to be available to provide information in between shifts. So she met both in the break room, in between shifts, as well as out in the parking lot, and was able to share information with employees in that respect. So it's a matter of creativity, but by all means, working with the employees within their cultural boundaries.
There was a second part to that question too, to be fair, and the second part is, has there been any thought about special support for employed caregivers whose children assist them in caregiving? And this is from Connie Siskowski, who's with the American Association of Caregiving Youth. So this is a very important issue. Are we taking into account our younger caregivers?
You know, Connie, I think
that's
that's such
up for us on a regular basis when we might have the caregiver who has the special need and who is actually the care receiver and employed and such, and the caregiver is the child or the minor, and we're challenged with that. And at this point, Nebraska has not been able, through at least the Lifespan Respite Subsidy, nor most of any of the other programs, because our regulations at this point in time are limiting eligibility criteria. We ask lots of questions and work to address it when it comes up on an individual basis. It's not being an ignored issue, but we don't yet have an across-the-board answer for you, Connie. But certainly it's on the table.
Under the Lifespan Respite Care law itself, certainly young caregivers would be eligible, but states have their own eligibility restrictions that sometimes they have to put in place, like in Nebraska. I think we're now past 4:30, and I do want to be respectful of everyone's time. Do any of our presenters just have any quick closing remarks you'd like to make at all?
This is Kristin. I just want to say that I'm so pleased that this information is getting out there, that there are groups thinking about this, that there are individual employers and organizations thinking about this. And I encourage anyone who is interested in the Employed Caregiver Survey in particular to email me or fill out one of the survey request forms, and we'd be happy to help you figure out how maybe you can use this in your own community and with employers that you may engage with.
And I would encourage others to start on a small scale, but at least start somewhere in a single community, but do begin working with employers to inform them of employee caregiver need.
Wonderful.
Absolutely. And I'm happy to help as well. This is Kim. If you'd like any other information about our pilot project or the presentation we are using for employers, please feel free to email me.
Wonderfully generous offers. Thank you all so much for a really great webinar and so many useful tools that we are taking away from this to use in our own work. I just want to remind all of you that to respond to our very quick survey to give us feedback on today's webinar and give us ideas for other webinars as well. For some of you, when you close out of the meeting today, the survey will pop up on your screen. For those of you who have firewalls against those things, you'll be getting the survey form via email. So again, thank you to our wonderful speakers. Thank you so much for your time. Thank you to all of you for bearing with us through some technical difficulties and a terrific thunderstorm we had on my end. But thank you all, and we'll be talking soon. And the webinar will be recorded, so you'll get a link to the recording when it's available. So that concludes today's webinar. Have a wonderful afternoon, everyone. Thank you so much.
You too, Jill.
Thank you, Jill.